Our pets are more than companions. They're cherished members of the family. Every wag of a tail, gentle purr, or playful leap is a reminder of how much joy they bring into our lives. Just like any family member, their health and happiness are our responsibility. But while love and attention go a long way, caring for our pets means staying proactive about their well-being. Today, we're exploring an often overlooked but absolutely vital part of pet healthcare: blood tests and routine checkups. We'll discover which tests matter most, what they can reveal, and how often your furry friend should have them. Whether you're a first-time pet parent or a seasoned animal lover, this guide will help you understand how to keep your pet healthier for longer. Why are blood tests important for our pets? It's a question every pet owner should consider. Animals are masters at hiding discomfort. Unlike humans, they can't tell us when something feels off, and many illnesses develop quietly, showing little to no symptoms in the early stages. You might look at your dog bounding around the backyard, or your cat sunbathing on the windowsill and think, everything's perfect. But beneath the surface, subtle changes in their blood chemistry can signal the beginnings of health issues that are invisible to the naked eye. Blood tests give veterinarians a window into your pet's internal health, offering clues about organ function, immune status, and much more. They help us catch illness early, often before symptoms appear, which means treatments can start sooner and outcomes are usually better. Think of it as an early warning system, one that gives your pet the best chance at a long, happy life. Let's start with one of the most fundamental blood tests: the complete blood count, or CBC. This test is often the first step when a vet wants to assess your pet's overall health. The CBC looks at three major components of the blood: red blood cells, white blood cells, and platelets. Each of these plays a critical role in keeping your pet healthy. Red blood cells are responsible for carrying oxygen throughout the body. If your pet's red blood cell count is low, that could indicate anemia, which can make your dog or cat feel tired or weak. Sometimes, anemia is the result of chronic disease, blood loss, or even an underlying infection. Next, we have white blood cells, which are the body's defense soldiers. They fight off infections and alert the immune system to invaders. An unusually high or low white blood cell count can point to infections, inflammation, immune system disorders, or even certain types of cancer. Lastly, platelets help the blood to clot. If your pet's platelet count is low, they might be at risk for excessive bleeding or bruising, which could be caused by infections, immune diseases, or even toxins. Imagine your cat seems a little more tired than usual, taking longer naps and not chasing toys with the same enthusiasm. A CBC can help your veterinarian determine if this is just a bit of laziness, or if there's a deeper issue like anemia that needs attention. Next, let's talk about the biochemistry panel. This test goes beyond blood cells to examine the substances dissolved in your pet's blood, providing a detailed picture of how well their organs are working. The biochemistry panel measures enzymes, proteins, electrolytes, and waste products, each of which tells a story about your pet's internal health. Liver enzymes are one of the first things veterinarians look at. The liver is a vital organ responsible for detoxifying the body, producing essential proteins, and aiding digestion. Elevated liver enzymes may indicate liver damage, inflammation, infection, or exposure to toxins. Early detection is key, as liver issues can progress silently until they become serious. Next, the panel checks for kidney values. The kidneys filter waste from the blood and regulate hydration and electrolytes. Changes in these values can detect early kidney problems, sometimes before any outward signs like increased thirst or urination occur. This is especially important, as kidney disease is common in older pets, particularly cats. Blood sugar is also measured, giving clues about your pet's risk for diabetes. High blood sugar can be an early sign of diabetes, while low levels can signal other metabolic issues. If you notice your dog drinking more water than usual and needing to go outside more frequently, a biochemistry panel can help your vet determine whether this is due to diabetes, a kidney issue, or something else entirely. Another important test, especially as pets get older, is the thyroid panel. The thyroid gland, located in the neck, produces hormones that regulate metabolism. In cats, hyperthyroidism, an overactive thyroid, is a common concern. It can cause symptoms like hyperactivity, weight loss despite a good appetite, increased heart rate, and even high blood pressure. In dogs, the opposite is more common: hypothyroidism, or an underactive thyroid, Symptoms can include fatigue, hair loss, weight gain, and skin problems. Because these signs can be subtle or mistaken for the normal aging process, thyroid testing is invaluable. When a vet orders a thyroid panel, they're checking your pet's metabolic balance, looking for hormone levels that are too high or too low. Early detection allows for effective treatment, helping your pet maintain their energy, coat quality, and overall health. Blood tests can also screen for parasites and infections that, if left unchecked, can cause serious harm. Heartworm disease, for example, is transmitted by mosquitoes and can be fatal if not caught early. The heartworm test detects whether your dog or cat has been infected, even before symptoms show. There are also blood tests for tick-borne diseases like Lyme disease, ehrlichiosis, or anaplasmosis. These illnesses can be tricky. Your pet might look perfectly healthy on the outside, while dangerous parasites are silently damaging their organs or immune system. Early detection through blood work is critical, as these conditions can often be treated successfully when caught in the initial stages. For example, a seemingly healthy dog might be carrying a tick-borne disease picked up during a walk in the woods. If left undetected, these diseases can cause chronic pain, lameness, or even organ failure. Blood tests, in this case, can truly be life-saving. Now you might be wondering, how often do these tests need to be done? The answer depends on your pet's age, breed, medical history, and overall risk factors. However, there are some general guidelines to keep in mind. For puppies and young pets, veterinarians typically recommend a thorough checkup, including basic blood tests, at least once a year. This helps establish a baseline for your pet's health and ensures any congenital or early onset issues are detected promptly. As pets reach middle age and beyond, the risk of chronic diseases increases. For these older companions, blood tests should be performed at least twice a year. More frequent testing may be necessary if your pet has a known health condition or is taking long-term medication. Always follow your veterinarian's advice, as they'll tailor recommendations to your pet's specific needs. Regular blood work isn't just about finding problems. It's about monitoring trends and catching subtle changes before they become serious. There's also an important role for pet owners when it comes to preparing for blood tests and checkups. A little preparation can make a big difference in the accuracy and usefulness of the results. For biochemistry panels, it's often best to bring your pet on an empty stomach, unless your vet tells you otherwise. Fasting helps ensure that the test results aren't affected by recent food intake. Keeping notes about any recent changes in your pet's behavior or habits is incredibly helpful. For instance, jot down if your dog has been eating less, drinking more water, or acting more lethargic than usual. These observations provide valuable context for your veterinarian, making it easier to interpret test results and spot patterns that might otherwise go unnoticed. Even small details, like a change in appetite or a new lump on your pet's skin, can be important clues. It's also helpful to bring along a list of any medications or supplements your pet is taking, as these can sometimes affect blood work. If you have questions or concerns about the testing process, don't hesitate to ask your veterinarian. They're there to guide you and ensure that your pet receives the best possible care. In summary, blood tests and routine checkups are about more than just responding to illness. They're a cornerstone of proactive, preventive health care for our pets. By catching problems early, we can often manage or even prevent serious diseases, helping our pets stay happy and healthy for years to come. Remember, our pets can't tell us what hurts or when they feel unwell. They rely on us to listen, observe, and advocate for their health. Blood tests give them a voice, revealing what's happening inside and unlocking the secrets to longer, healthier lives. If you truly care about your pet's well-being, make regular blood tests and checkups a priority. Work closely with your veterinarian, keep track of changes in your pet's behavior, and stay informed about their unique health needs. By doing so, you're giving your furry friend the gift of more good days, more adventures, and more memories together. Thank you for being a dedicated, caring pet owner. Your commitment to your pet's health makes all the difference. If you found this information helpful, don't forget to like and subscribe, so you'll always be the first to know about new tips and insights for keeping your pets happy and healthy. Together, let's build a stronger, more knowledgeable pet-loving community. Until next time, take care of your furry family members and yourself.